A healthcare system struggling to meet the needs of the population often finds a bottleneck at the inpatient bed. These highly coveted rooms are essential in treating our sick and most vulnerable patients. How do we ensure that patients in need of this vital resource have timely access? The operating room. Surgery in women's health conditions is often necessary because it improves quality of lives and even saves lives. However, traditional gynecologic surgery often requires a long length of stay because of pain, requiring the gut to recover, and a multitude of other factors. However, today, we have a better way. We asked whether patients with complex gynecologic conditions could undergo a minimally invasive hysterectomy and be safely discharged the same day. Just as important was to ask the patients about their experience and whether this novel approach could help the healthcare system and, moreover, help the patients themselves. The Ottawa Hospital was already a leader in minimally invasive hysterectomy. For women who need a hysterectomy, it is better to provide this care through a smaller incision, either vaginally or through keyhole surgery called laparoscopy. Tiny incisions can allow for complicated hysterectomy to be done with a better overall recovery and less pain. At TOH, we had already seen a dramatic change in our rate of minimally invasive hysterectomy. Big cuts for hysterectomy dropped dramatically over a 5-year period as the hospital made less invasive surgery a key priority. As a result, by 2012, 75% of hysterectomy cases were already being done less invasively. We in fact saved 2,000 inpatient bed days just by doing that. However, we knew we could even do better. While we were doing well with minimally invasive hysterectomy in Ottawa, we knew we could do better because our patients were telling us that they were ready to go home sooner. Yet we needed to set up the right pathways and the system, and that's what we did through this project.
It's very exciting to be part of this project. We started off with a very simple question, and getting patients through safely through complex surgery in an efficient way when putting the patient first. So we started from a grassroots level, discussions with surgery, the administration, the hospital, nursing, and anesthesiology. We had an excellent working relationship, and this project allowed us to even have a much better discussion at various simple things, breaking things down in a simple way and keeping the patient as a focus.
With the right system in place, our project showed that 92% of patients can safely be discharged home the same day of their surgery. 98% of these patients would recommend this procedure to a close friend or loved one.
We did it at an academic center, but this can be applied to to a community setting. There's no reason why we try to develop a very general, simple approach to perioperative care, which can be applied to any community center and even a daycare center.
Pour nos patientes, nous pouvons démontrer avec succès que nous pouvons faire des chirurgies minimalement invasives et retourner à nos activités quotidiennes, nos travails et nos amis le plus rapidement possible. L'approche minimalement invasive a démontré que l'approche conventionnelle peut être remplacée et avoir un changement et une adaptation nouvelle, confortable pour chaque patiente.
So we can do it. We can free up our beds in our system. Minimally invasive surgery in skilled hands and in an institution that aims to make it a priority can improve discharge times without affecting patient safety or patient experience.